So I'm going to come into the room. I'm going to gather my equipment. I'm going to introduce myself. I'm going to provide some privacy for my patient. I'm going to obtain the proper lighting to do my assessment. I'm going to wash my hands and just observe the general appearance of my patient. She looks very clean. I don't notice any dirt or anything under her nails. Her clothes are clean. I am going to look for any physical deformities, and I don't see anything, nothing, out of the ordinary. I'm going to assess her mobility, her gait, her range of motion, involuntary movements, maybe just by, getting her to move around a little bit, maybe do some, and give your legs out towards me, very good. Turn your head side to side, good. Okay, so like I said, personal hygiene, everything looks good, she's clean. She's dressed appropriate for the season. Obviously, she's in her scrubs at work, so that's appropriate. Her skin color's good. It's consistent with her ethnicity. And I've looked at her nails. Her nails are clean. Her nail beds look good. They're at a 180-degree angle. No clubbing. And her hands look good. No deformities there. Her posture is good. Her mood is good. She's talked to me. I had no problems with speech or hearing. And it looks like she is well nourished in the best way. So now I'm going to go ahead and assess her head and her face. So when I'm looking at her head, I'm going to just kind of rub my hands around, feel for any lesions or bumps, anything abnormal. She has good eye contact with me. Level of consciousness, she's completely alert and oriented. Her hair is clean. I don't see any dirt or any abnormalities, any missing hair, nothing like that. Her facial symmetry is good. It is symmetrical. Her eyes, her smile. Her temporal arteries, I'm going to feel here. I'm going to feel your temporomandibular joint, so open your mouth. Good. And your maxillary and frontal structures all are perfect. Okay, so now I'm going to go ahead and look at your eyes. What I'm going to do now is I'm going to do a peripheral vision test. So what I need you to do is just tell me whenever you can see my fingers. No, okay. Okay, her peripheral vision is intact. I'm going to look at your corneal light reflexes. Okay, so I'm just going to take a look here and very good. And then the other side. Very good. Okay. When I was doing that, I was also looking to see her conjunctiva are pink, her sclera is white, no redness, no discharge. So I'm going to do to test her 6 cranial nerves, the three facial cranial nerves. Okay, so I'm going to have you just look at my fingers here. Okay, very good. And keep an eye on my fingers, in and out. Very good. And now I'm gonna cover one eye. Have you look at me. Okay. Now look at this finger here. Okay. Okay. Don't close your eye. Okay. Very good. Okay. Now I'm going to look at, and her pupil size were good, her perla was intact, and her response to light and accommodation, everything was good. If I needed to check her vision, I would do a Snellen chart test, which has letters that start with big at the bottom and go to smaller at the top, and then that would give her a reading for her vision, either 20/20, 40/20, whatever her vision may be. Now I'm going to go ahead and take a look at your ears. I'm going to inspect her external ear first. So I'm just going to take a look at it here. I'm going to use my light. And I'm going to look in the canal. And I'm looking for any redness or drainage. And her tympanic membrane is gray and shiny and normal. And then I'll check the other side here. Okay, very good. Okay, and now I'm going to perform a whisper test. So I'm going to close one side of your ear and I'm going to whisper, and then I need you to tell me what I said, okay? Apples.
Apples. Apples.
The second time was a little more whispered. Okay, so very good. She passed the whisper test. Now I'm going to go ahead and inspect her nose. I'm going to be touching your nose here. So I'm going to squeeze here. Now breathe out. Breathe out. Any problems breathing? Any problems with your sinuses? Okay. Now I'm going to take a look inside your nose. Very good. Minus a few flippers. Just kidding. Everything looks good. There was no drainage, no bleeding, and everything was symmetrical in there. Now I'm going to look at your mouth and your throat. Here I'm going to be inspecting her buccal mucus, her teeth, her gums, her tongue, the floor of her mouth, her palate, and her uvula. Okay, open your mouth. Everything looks great. Okay. Did you have a tonsillectomy? No? Okay. Her tonsils weren't swollen, and I didn't notice any white patches, any drainage, anything abnormal with those. So she said, I didn't have a tongue depressor. If I did, I would have used that to check her gag reflex. And she did. She could stick her tongue out, and there was no problem there. Okay, so now I'm going to inspect her neck. I'm going to inspect for symmetry, for any masses, lesions, pulsations, and any JVD. So I'm just going to look here. I'm going to feel around a little bit. Don't feel any masses or anything. Can you turn your head from side to side for me? Very good. And now I'm going to come behind her to check for her midline trachea. I'm going to kind of displace it a little bit just to see if I can do that in its midline, and it is. I'm going to have you swallow for me. Very good. I'm assessing her thyroid. Everything seems to be intact and symmetrical. Okay, so I'm going to check your carotid pulse. Okay. All right, very good. Any problems moving your neck? Can you do round and round? Very good. Okay, so that was the neck assessment. Now I'm going to go ahead and do the chest. So I'm going to assess the configuration of her thoracic cage. I'm just going to have you turn and kind of sit facing this way. Okay, here I'm just assessing the symmetry of her shoulders and her muscles. I'm going to have you say 99.
99, 99, 99, 99, 99, 99.
Very good. Now I'm going to squeeze back here, and I'm going to feel for the symmetricalness, for the symmetry of her lungs. Okay, so I'm going to have you take a big deep breath in. Okay, release. Very good. Okay. There's no masses. Was there any tenderness when I touched you? Okay. So now I'm going to percuss. Feeling for any dullness And the level of the range back here that I got for her diaphragm was about 6 centimeters. So I would say that's in the normal range. It's usually about 6 to 8. We can see more if a person is very athletic. It may be about 9 centimeters. I'm going to go ahead and listen to her breath sounds. Okay, take some deep breaths for me. Okay, I'm going to listen to the front side, starting at the very top, above the clavicle. Okay. I'm going to fill in here. I'm going to have you lift your breast tissue for me. Okay, deep breath. Okay, I'm going to listen to you again, and I'm going to have you do a few things for me. I'm going to have you say the words 99,
99, 99, 99, 99.
okay? Now I'm going to have you do the same thing, but I'm going to have you whisper it.
99, 99, 99, 99.
Okay, no problems there. I'm going to have you say the word E.
E, 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 E.
Okay. And what I was doing there is I was checking her whispered pectorology. I was also checking for her and that was with the whisper test. I did the bronchophony with her saying 99, and then the egophony with her saying E. So now what I'm going to do is I'm going to listen to her heart. I'm going to listen to all 4 of the valves of the heart. I'm going to listen to it with the bell of the bell, and then the diaphragm. When I'm doing this, I'm going to stop at the apical pulse, and I'm going to take the apical pulse and identify the rate and the rhythm. Make it easier for you to lift. Okay, we had some good S1, S2 heart sounds, no murmurs. I didn't hear an S3, S4. So everything seems to be normal in this assessment, and that would complete my assessment today.